Hello, everybody. Hope you're having a fantastic day. I am Janice Thornton, and I am an online personal trainer with JT Fitness and Golf. And I am so excited to be partnered with Edward Givens, and we are going to be reviewing a book. And this book is called Never Pay the First Bill and Other Ways to Fight the Healthcare System and Win. And we are very excited to be going through this book with you because we know there are a lot of challenges when it comes to our healthcare system. And as a personal trainer, I've actually spent 25 years either working in a hospital in cardiac rehab, or I spent another 14 years working in pharmaceutical sales. So one of the things that I truly want to help people with is being able to improve their health. But then I want to help you stay out of cardiac rehab. I want to help you get off medication safely. And this way, this book that Edward and I are going to discuss with you will be able to help you navigate through this crazy healthcare system. So Edward, I want to turn it over to you so everyone can learn a little bit about you.
Hello, everyone. My name is Edward Givens, and full disclosure, I'm an independent licensed health insurance agent. And like Janice, I have had well over 15 years of healthcare experience. I've sold medical devices, pharmaceuticals as well. But the lessons that I've learned, I found that I'd like to help people understand the system better. And last year, I actually came across this book, Never Pay the First Bill First and Other Ways to Fight the Healthcare System and Win. And in conversations Janice and I have had, like, more people need to understand this so they have a better understanding of what our healthcare system looks like today. We're not talking the politics of whether we should change it or how we should change it. We're just talking about what does it look like? How do I navigate through it? Because this is the reality of today. And so we thought a good way to do that would be to do a little book review on this, explain some of the information to you. That way you're better armed to take care of your situations as they pop up within your family.
Excellent. So Edward, I looked at the first chapter, of course, since that's what we're discussing today, and the author had some very interesting 5 points that he really made in this first chapter. And I guess to give a little background of what happened to the author was the author had his family, his mom and dad. The dad ended up in an assisted living, and the mom was power of attorney. However, the doctors were not allowing the mother to make the decisions as power of attorney. That's like they kind of took over when they did not have that right to take over. And this family had extra charges and extra exams that were done that shouldn't have been done. Yet this family was being charged for them. And they were having to fight the system of not having to pay some of these bills and really getting these doctors' offices to understand, no, you did not have the right to do what you did. So Edward, what can you kind of continue on with that, just so people kind of have the premise of what this book is about?
Well, and Marshall Allen is a reporter. And so when this situation occurred to him, he thought this would be a good opportunity to write about it. So that's why he wrote this particular book. Again, Never Pay the First Bill First and Other Ways to Fight the Healthcare System and Win. And after this experience with his family, he decided to delve in deeper and understand how the system works. And he's come up with, in his opinion, 5 key reasons we should fight back. 1, we're the ones paying for the healthcare. 2, the customer is always right, but healthcare power players don't consider you their most important customer. 3, the business of medicine exploits your sickness for profit. 4, the healthcare industry wastes obscene amounts of your money. And 5, our healthcare system is not broken, it's made that way. So these are the premises we're going to talk about today. And again, don't despair. The idea is, let's understand the playing field we're on. Let's understand what the system looks like. And the nice part about this book is it gives us some decent ideas on how to navigate it. as you read through this book. So we're also going to, in future sessions, talk to you about that and how to navigate through the system. So if you find yourself in any of these positions, you understand what to do next.
Well,
And
I think I like the first. Oh, go ahead, Edward.
I was going to say, I like the first one. You know, we're the ones paying for the healthcare. There's a lot of things set up in our society where we just don't look at it that way. And he makes a good argument as to why we're the ones paying for the healthcare. But go ahead, Janice.
Well, I was going to say, yeah, we are the ones paying for our healthcare. You know, we look at our employers and the compensation package that we get, and really in that compensation package, they are just taking money from us to pay for that, our healthcare costs. But in essence, we truly are paying for the healthcare that we are receiving. And a lot of employers like to make it sound like they are giving us all this great stuff. In essence, it's really your total compensation package. So in essence, you're really paying for the healthcare that you're receiving. And quite honestly, when I was reading that, it made a lot of sense. And too bad we didn't get to make more decisions in what actually we get for coverage of that healthcare that we're paying for.
Correct. And he also makes the argument in there that just for him alone, between 2012 and 2020, he's paid more than $16,000 more in premium because of the price increase that he's incurred each year. And a lot of people, like you said, don't look at it that way unless they happen to go into Cobra and they get their Cobra bill after they leave their company. They realize, oh my gosh, I was only paying, $200 a month for insurance for my family, and now I'm paying $1,200. Well, $1,200 was the true cost that they were paying. Just the employer's compensation to them covered the difference when they were employed.
Yes.
And he also makes the point too, Medicare. Most people, this is the new year. So we need to look at the fact that we're going to be paying taxes in April. And do you have Social Security taxes that you've been paying? And that pays for Medicare. So Medicare is not free. We still pay for it, even though you'll see ads out there saying $0 premiums. At some point in time, we have to pay for it, and it comes from us as taxpayers. Medicare and Medicaid are the same way. Medicaid is going to be from the state level, and those are going to be your local taxes, or in some states that have property taxes or consumption taxes, it's going to come from those. But again, we're still paying for that care in the form of our taxes. And then don't think that teachers or federal employees or state employees or even folks in the military, we're still paying taxes to pay for that care. So try to remember, we are always paying for our health care. It's just how much do we get to determine where that money goes.
Correct. And unfortunately, we don't get to determine where a lot of that money goes. And I think you nailed it on the head when you said people do forget when the stuff is free, or called free, that we, you, me, and everyone who's watching this video, we are the taxpayers paying for this stuff. So nothing is free. And people really need to be, if you look at your paycheck, you can see how much goes to Medicare, how much are going to federal taxes, state taxes, and all the different taxes that it goes to. And we are all paying that. And nothing is free. Nothing. The third one, go ahead.
Go ahead.
The third one was: a business of medicine exploits your sickness for profit.
Yes.
Elaborate on that.
Well, the challenge with when we're sick is that we're sick. We're not feeling well. We're not at our best. So our guard is down. If it's a close family member of yours, your guard is down because you want them to have the best care you can possibly get. If you have a good doctor, a good nurse, or even a good hospital system that you trust, you're trusting them to make good decisions for you, but you're forgetting the business side. And that's what he brings up in this book. Hospitals exist as a business.
Yes.
Doctors and nurses, for all the care they give us, still are in a business. And then on the other end of that, the insurance companies are a business. So what gets lost in that translation is the business portion. Think
And that's
about
where
the fact
people,
that you wanted to order a pizza and you go to your favorite pizza restaurant and you give them your order, and what comes back is not what you ordered. They added some things that you didn't ask for, or maybe some things you're allergic to. Would you accept that pizza? You'd push back and say, no, that's not my order. I want something different. This is what I want, or this is what I've paid for. But when it comes to healthcare, we order up, make me better.
yeah.
They say they make us better, and then they give us a bill adding things that we didn't ask for. Now, does this happen in all cases? No, absolutely not. But if we don't know what we're looking for, and we don't understand how the business side works, we don't know how to push back so that we don't get overcharged for something. And that actually brings to light that as of January 1st of 2022, surprise billing under certain circumstances is now illegal.
So elaborate on the surprise billing.
Okay, and it's very specific. So people, you can actually look this up by going to cms.gov and looking up no surprise billing. And starting January 1, consumers will have a new billing protections when getting emergency care, non-emergency care from out-of-network providers at in-network facilities, and air ambulance services from out-of-network providers. Through new rules aimed to protect consumers, excessive out-of-pocket costs will be restricted, and emergency services must continue to be covered without any prior authorization and regardless of whether or not a provider or facility is in network. So this doesn't mean you cannot get a surprise bill, ever. But what it means is if you're in an emergency situation, they can't surprise bill you, even if you're at a non-network hospital. But
So
if
you
you
had a great
choose,
example.
I'm sorry, what's a great example?
You had a great example the other day of that surprise bill if you were out of state. And
Yes, if something happens to you
so
out
give
of
that
state,
example. Yeah.
So if something happens to you out of state, and you most likely are out of your network, especially if you have an Affordable Care Act style plan, and it's an emergency, your care now under these new rules, you can only be charged at your in-network rate. So you would come home after that incident, maybe it's 2 weeks later, you're not going to get a surprise bill from a doctor or from a hospital system saying you owe us additional monies because you were out of network. That's what this rule is saying. Just like if you're being moved by an air ambulance someplace, it's going to be at whatever your network rates are. However, if you choose to go out of network to get care done, you can have a surprise bill. You can be billed for that by the provider because that is your choice to seek an out-of-network provider. But under emergency circumstances, we now have some new protections for folks.
Which that's awesome. And I did want to touch back on what you were talking about. You know, when we get into the hospital, we get these bills and we're sick. We just want to get fixed. And that's when we start thinking with our heart instead of so much of our head because we don't feel good or our loved one doesn't feel good. I know when I worked at the hospital, and Edward, you probably can relate to this, you know, the one word I heard all the time was reimbursement. And I heard that word every single day. And I guarantee you that is the thing that these hospitals are looking for every single day. They are a business, like Edward was talking about. Hospitals are a business and they want to make money. They need to make money. And I think that's where people forget that, yes, we have life and death situations, but at the same time, it's still a business. And we have to remember that and be ready to like look stuff over. And when you get your bills, treat the hospital like a business or the doctor's office like a business, that they overcharged you. And I think to me, for myself, it gives you more empowerment when you can kind of think of it that way. that if you can also look at it as a business, it makes you feel stronger, I guess is what I'm trying to say.
Well, it makes you feel stronger. And sometimes people still forget our doctors and nurses are just people. So they don't know your personal scenario. They don't know your family issues. They know the algorithm, which helps them diagnose and treat you. But without enough information, they can only give you their best recommendation. And that's what you always have to remember. It's a recommendation on what to do next.
Right.
You still get to make the choice. And so if you push back and ask a few questions, ask them to justify, why do I need this test? And can I get it at another location, or can I get it at a separate time? That it may make more financial sense for you and your family to do it that way, and yet you still get the care you need.
Yes. And I think for some clinics, so in hospitals, they've bought so many other locations that they always want to stay in network. So for them, they want to do everything they can to stay in network, which it may inconvenience you as the patient to have to drive a certain distance to go get that chest x-ray or whatever test it is that you need. Because I know one of the places where some physical therapy was being done, and this is when I lived in Tulsa, people they might live in the north side of Tulsa and they had to drive all the way to the south side of Tulsa to get like physical therapy done because it was the only location that insurance would cover. And I'm thinking, how crazy is that people can't, there's not a location in North Tulsa that people can go to instead.
Well,
so
and that's part of the business of healthcare, is when they create some of these plans and networks. There's what are called skinny networks. You have very few hospitals and very few doctors, but you do have a much lower premium, but you might have that inconvenience of driving half an hour just to be able to see somebody, to have things done. If you have a much larger network, a broader network, or a nationwide network, you're going to pay the premium to have access to that. So that's the side that people have to remember when they're looking. If I get a really skinny network, I may end up driving further. When I was living with my parents and still in high school, my dad is a veteran, and it took us 40 minutes to drive to the military hospital.
Oh my gosh.
But that's what I knew. It's like, okay, if we got to the hospital, we got to go up on the mountain. So we got to drive all the way over there.
Wow.
And those are things that people have to take into consideration. Fortunately for my parents today, that hospital moved and it's now like 5 minutes from their house.
Okay, that's good.
But yes, we must remember that it is a profit center. And because it's a profit center, the business side of medicine exploits even the frontline clinicians, because a lot of people notice that the doctor has less time to spend with you to really understand what's going on, because I have to see 15 patients today, and I have to do chart work, and then I have to do rounds, and there's other things they have to do during the day, but their time is crunched because of the way the healthcare system is set up to make money. If we can understand that, then we can guide ourselves through it.
Absolutely. Well, like number 4, the healthcare industry wastes obscene amounts of your money.
Yes.
And they definitely do.
Just like anything where you don't get to see what is actually happening, you don't get to pick what's going on. It gets lost in translation. Somebody just adds another $10 here, another $50 there, another $100 here, and the system gets bloated. I just ran some quick numbers. In Maricopa County, if you're a family of 4, an average family of 4, parents aren't over 45 years of age, without any type of federal subsidy, at a minimum, the lowest premium you could pay is around $970. And that's per month. If you want to go to Cadillac plan, you're going to be paying $2,500 a month. That's a mortgage payment.
That is a mortgage payment.
Mm-hmm. And a really nice mortgage payment at that.
Yes, it's a really nice mortgage payment at that. Oh
But
my
that's
gosh,
what people would be paying without any type of subsidy. So this is what people need to remember. They're getting subsidies, so most people aren't paying that price, but that's how much the federal government is paying for people to have those types of plans.
so who qualifies for a subsidy?
Well, it's all going to depend on your age, your family size, your income, and your zip code.
Okay.
And then the federal government makes a determination on how much subsidy that family would get.
Okay.
But a lot of times people focus on that and they go, oh, okay, great. My bill's $100 a month. I can do that without actually looking at the fact that, yes, you're paying $100 a month, but your plan actually costs $900 a month.
Mm-hmm.
Oh, and by the way, your deductible and your out-of-pocket limit went up another 10% from last year.
Yeah.
One of the things he brings up is, the healthcare system, insurance companies are out for themselves. So they're not going to, they're betting that the premiums that they have will cover the costs that they need, allow them to make a profit, and still be a viable business. But if they quote unquote lose that bet and there are high expenses like COVID,
yes, no kidding,
has increased expenses for the past couple of years, they don't go out and start cutting their costs. They go out and increase their prices.
Mm-hmm.
And that helps them cover the loss that they had the year before.
Yes, and that's what the pharmaceutical industry does though too, is just keep increasing prices to cover any kind of losses that they have.
Correct.
I'm sure you got those same voicemails I did when they would talk about your drug prices going up, blah, 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 percentage, and there you go. Make do.
Yeah.
Yes.
And we did skip over one thing, because a lot of this ties back to his second premise of the customer is always right, but the healthcare providers, the healthcare power players don't consider you the most important customer.
Oh, that's right.
Kind of in how we're talking about this, we see ourselves as the customer because we're purchasing the healthcare. I need it when I get sick. I need it to take care of my family members for any illnesses or injuries. But we have that middleman of the health insurance company who actually pays the provider.
Yes.
We pay the health insurance company. The health insurance company pays the hospital and the doctors, but we don't get a choice or a seat at the table for deciding what that cost is going to be. And a lot of our professionals are unaware that, hey, I might have company's A's health plan for my company. The company I work for provides a health plan through company A. I can get a health plan through company A on my own, or I can get a health plan through company A through the Affordable Care Act, but they're not the same health plan.
Right.
Even though it's the same company name. So I could go in and have surgery and pay $10,000 for the surgery on my company plan. But if I bought it independently, I might end up going in and paying $30,000 for it because I'm an individual.
Which is just crazy though, that's how that all works.
It is, but it is how our system currently works. So how do we navigate and know what's the right choice to make? What's the right bill that I'm getting? Because there aren't many people out there who are going to say, I'm not going to pay the bill. They're willing to pay the bill as long as it's reasonable.
Correct. It's just when they throw all the add-ons.
Bill.
Yes, absolutely. Well, and I was going to say too, and of course, this is where my being a personal trainer, exercise physiologist comes in. Of course, like I said earlier, trying to help people stay healthier. Obviously, we all get sick. We're all going to get sick at some point, but we can reduce symptoms. We can reduce the number of times we get sick, and truly we can reduce our healthcare costs. Because the healthier you are as you get older, and correct me if I'm wrong, if you're healthy and you're getting this insurance, you may pay less in premiums based off of your health status.
Well, in general, you always will. So let's think about this. Somebody who's healthy and gets into older age and has fewer issues that require surgical care, fewer issues that require rehab, catch an issue before it starts, are going to reduce those costs and actually save yourself some money. That ounce of prevention. That's why I thought this would be a great opportunity for us to have a conversation, because helping people, one, understand what are those preventative things that are already covered that they should take advantage of.
Yeah.
Two, what are some other ways to be healthy so that they have control of their health to a certain extent, so they can reduce those costs, can be brought up to help them lower those expenses. I have a friend of mine who's a neuroscientist, and he does different talks about people with cognitive decline. And just in our area, in the Phoenix area, if you live south of I-10, statistically, based on the numbers that he's come up with, your lifespan is 11 years shorter once you turn 65 than if you live north of 10. This is not due to a fact of lack of resources. This is due to a fact of lack of information.
Oh my gosh, that's crazy.
Yes, and when he showed me those numbers, I was shocked, because I could expect that across the country, that type of a span. But in such a short distance, one city, you have that kind of disparity. It makes me wonder, well, what's going on in other cities?
Right.
And when you have resources here that can help people, but they're unaware of them, they don't know how the game is played, so they don't know how to navigate through it, then they're going to end up paying more. And part of it's selfish, because if they end up paying more, that means they're putting more drain on the system, and I end up paying more.
Right.
Because I have to pay more taxes to help cover that challenge. But if we're aware of those challenges, we're aware of how we can take better care of ourselves, preventative things. And then if we do have to use more intensive resources, how to make sure those resources are used effectively for us, so we don't have to pay a whole bunch out of pocket.
Right.
Then as a society, we'll all be healthier.
Absolutely. I like how they worded number 5 on our healthcare system is not broken. It was made this way.
Yes.
And like in the chapter, it says if they wanted to fix the problem, they could, and they would. But it's such a entangled system, a very well-paying system to the hospitals and insurance companies and pharma.
Well, it's an entangled system, but again, it's one, if we can understand how to navigate it, we can make certain changes that will be positive. Are we going to fix it and make it perfect? Not in my lifetime. But understanding how certain things are done allows us to push back and forth. As an example, you were in the pharmaceutical industry and I was too. We know that some medications were like, that's just a ridiculous cost.
Yes.
For what it is. For certain people on certain Medicare plans, their insulin should not cost them more than $35 a month now. Okay? That is a positive change in the system, but it's not on every plan. So people have to understand which plans it's on to know which option to choose.
Right.
The other thing is, and especially from my position where I look at it, sometimes people get too connected to certain things. They may be too connected to a particular doctor or too connected to a particular hospital system which makes them waste money and not get treatment that they could get if they would be more selfish and act in their own best benefit. What works within my budget? Where can I go get the care that I need on a routine basis so that I can be healthy and prevent illness rather than reactive and react to worse illness?
And I think sometimes it's good to actually switch doctors to get a different perspective on what's going on with you. If you've been with the same doctor for 30 years and kind of been growing up with that doctor, guess what though? Maybe they have like more of a tunnel vision of what's going on with you versus you see someone new, they might just open up your eyes to some completely different thoughts of how to make your health even better. And I think people get complacent with the doctors that they have. And it's not the easiest thing to switch doctors, but sometimes, like you said, you might be saving money though, if you can switch into a different system, and maybe it's just as close to your house as this other doctor is as well.
Yes. And just maybe their perspective is a little bit different. One doctor trained on the East Coast and has a certain perspective. Another doctor trained on the West Coast and has a different perspective from that one, which may benefit you more.
Yeah, absolutely. Absolutely. Well, what else do we need to cover on this chapter?
Well, I mean, we talked about some things that a lot of people, I think, kind of know intrinsically. They feel the pain here. They're like, this system is against me. Everything costs too much. I'm paying more every year. When I try to get an answer from the insurance company or from the hospital, they give me the runaround and I don't know where to go. You know, I talk to my employer, but nobody there knows what to do, and they just give me the same number to call. So people are sometimes frustrated when they're hurting, because most people don't get to this point until they're actually hurting. Most people are blindly ignorant. I'm paying my premium, and if something happens, I've got insurance.
Right.
What we're trying to say here is there's an option for you when that hurt comes, or if that hurt comes, to navigate it successfully and not overpay and not get the runaround for an issue. As you brought up earlier, Marshall Allen spoke, decided to do this because of his parents, but he spoke to other people who have had serious issues where something was left in their body and they had one surgery and then they had to go back and have a second surgery, and they end up having to pay for the second surgery. There are some things people can do beforehand to prep, to make sure all their questions are answered, to reduce the potential for something like that to happen in the future.
Right, because yes, when I read that, I was thinking they shouldn't have had to pay anything for that second surgery when none of it was their fault. It was completely the hospital's fault.
You're absolutely right. And most people would think that. Think about it this way. If you took your car in to have your brakes redone and you drive off the lot and your brakes aren't working, you'd have it towed right back there and expect everything to be done without you paying a cent.
Exactly.
Unfortunately, the healthcare system doesn't work that way.
I know, but it should. You're like, I didn't leave the scapula in my leg, but you did.
Well, years ago when I sold medical devices, I remember one of the doctors who used to speak for one of the companies asked a group of physicians, hey, had anybody ever had a problem with a certain type of procedure? Nobody in the room raised their hand. Then he asked them the question, how many of you have fixed that same problem from somebody else? Everybody in the room raised their hand. So what happens is when something goes wrong, especially in healthcare, people will tend not to go back to that same person.
That's true.
They'll go to somebody else. Sometimes that's the right thing to do, but sometimes it's the wrong thing, because then we lose perspective on what the issue is.
Well, that's why they can say, well, you're not going to the same doctor to fix the problem. You're going to someone else. So this is more of an elective, they could claim it's an elective surgery almost because you're electing to get that part out of you. But no, it's an interesting concept, but it would be hard to go back to that doctor to say, hey, open me back up and take out whatever you left in there. Yeah. Well, this is why you want to, for sure, like Edward definitely can help you with navigating insurance and making sure you're selecting the correct things for you and making sure that you're not wasting money. Because I can guarantee you this. So since I've started networking with Edward, he really does care about you and you and your family. He wants to make sure that you are getting the best. He researches so much stuff. And I think between your military, your medical, pharmaceutical backgrounds, yes, you follow attention to detail to a T. Make sure that everyone is making sure everyone's getting what they really, what they deserve. And you don't want people to overpay. And that's what I really like. You're in it for the client and making sure that they are well taken care of. And that's what I like.
And I like partnering with you because you're trying to help people prevent issues by being proactive about what we're doing as far as our health is concerned. We leave a good positive legacy for our family because then they don't have to stress about our issues and our injuries and our illnesses if we're being as healthy as we can. Now, don't get me wrong. There will be things that will simply happen. There's nothing we can do to prevent them. But if we're prepared and we're talking about these things, it's easier for us to deal with them than if we don't talk about them. And
absolutely. Absolutely. Well, Edward, I think we should wrap up this chapter. And we will be back on next week to do the next chapter or two. And Edward and I will put our contact information in the comment section below. And that way, if you want to reach out to any of us or have any kind of questions, you are able to do so. So everyone have a fantastic day, and we will see you next week.
Have a great day, everyone.